And like she said, I'm Tricia Montgomery. I'm nutrition faculty at PVCC, and I also help with our nutrition degree program, which is in dietetic technology. So many of our students finish that and start working in the profession. I have Bella and Teresa here with me today. They are in our program, as well as they are continuing on to get their bachelor's to become registered dietitians. I'm a registered dietitian and a certified diabetes educator, so I have a passion for teaching all about diabetes. So I'm so happy that we could make this happen and that Bella and Teresa are here with us to teach you all the wealth of knowledge that they have. And I'm going to let them introduce themselves further because I know they have a long history of background and wealth of knowledge that they can share with you. And so I will just go ahead and hand it over to Bella, and Bella will get started.
All right, well, thanks, Tricia, for that very generous introduction. And thank you for inviting me and Teresa here to help teach you guys today. So I'm going to start presenting. Let's see, I'm going to just turn it on real quick here. But yeah, I appreciate everyone being here today and just being patient. It's just going to load up here real quick. Just let me know when you guys see my screen by any chance.
And just so you all know, you can use the chat feature if you have any questions, and I'll be monitoring the chat for Bella and Teresa because some people may not be able to get their audio to work. So if you feel more comfortable, you can always open chat and put your questions in there. We'll make sure to answer those.
All right, let's see, view entire screen. It is loading. Again, thank you everyone for your patience. And do you guys see anything? Let me know. Bella. You see it? It should be loading.
Yep, your screen is up.
All right, it's just loading right now. All right, awesome. Okay, so we're going to start off session 1, which is diabetes self-management, and we're going to do an overview and monitoring. So I know we kind of have a diverse audience here, whether it's my fellow classmates, registered dietitians, or someone who may be newly diagnosed, or just someone who's curious to know more about diabetes. So we're going to take it very simple and just kind of introduce everything to you guys today. All right, so first, I just want to introduce myself. So my name is Bella, and like Tricia said, I'm currently a student at Paradise Valley in the dietetic technician program. This is my last semester at PV. As much as I love it, I'm excited. And so I'll be able to take that DTR exam pretty soon, so I become a registered diet technician. So I'm going to transfer to ASU this summer, and then in the winter of 2022, I'll graduate with my undergrad in dietetics. And then outside of school, very busy. I have a 3-year-old kiddo, and I have multiple jobs, but my main full-time job, I work at Honor Health as a diet rep. So I help take patient orders and making sure that it's compliant with whatever diet they may be on. If they have diabetes, making sure that they're staying under that carb amount, or checking the trays, making sure that they're getting the food they're supposed to, ordering tube feeds, all that fun stuff. And I also work at Tailored Bites, which is a nutrition concierge. So they do meal preps, and they also do consults as well. And I'm very passionate about dietetics because I think it's amazing how food has the ability to hurt in certain ways, but then it also has the ability to heal. It's a tool, and we just have to be aware and know how to balance it. So that's why I love dietetics, and that same phrase also has to go with diabetes too. So I'm excited to jump into that and talk about that today. All right, so before we kind of dive into what diabetes is, I just want to see how you guys feel. And if you guys don't have any input, that's fine. I can definitely fill in. But like our feelings towards diabetes. So when you think of it, or when you got a diagnosis, what was that initial feeling? So if you guys have any input, just feel free to jump in. I know when I was researching this, and even working in the hospital, when I have like new patients that are newly diagnosed, for them, they're initially not necessarily sad, but they're also very frustrated. They're frustrated because all the foods or the way they eat, they have to unlearn and relearn. So that's definitely a common emotion, as well as being sad, because like I said, it's just definitely like a new thing for them to overcome, new, medical education that they need to learn. So a lot of just frustration and sadness could definitely come with that. And, you know, they're sad about their health, they're worried. And then some common emotions towards managing diabetes. So it's after the fact that you were diagnosed with it. So like I said, frustration, very, very common. Frustration or maybe anger, because sometimes, you know, they could be working super hard to keep their blood sugars at a certain level, and maybe it might not be that way. Or anger because they can't eat certain foods the way they used to. And it also has to do with the environment as well. If you're living in an environment where maybe they're not as supportive, your loved ones, with how you eat, or encouraging, or almost sabotage you with the way they eat, that definitely can be very frustrating and make it less likely for you to be able to successfully manage your diabetes. So how do we overcome those emotions? So a lot of it has to do with self-control. So we're going to talk about that in the next few slides, but just overcoming these emotions and just knowing that there is a handle on diabetes, even though if it's a new diagnosis or if it's something you had since you were a kiddo, it's just learning how to cope and just kind of have to move along and make ways for that change, whether that's educating, making sure you have a good group of people to support you, and just embracing the journey, because like any hard trial in life, that's what it is, just embracing whatever may come your way. So that's what it is with diabetes. It's a lot of emotions, a lot of feelings, but there are resources and people to help you as well. All right, and then this was a cool fact that I found online. So as we know, anger initiates the stress response within the body, causing blood sugar levels to rise, heart rate and blood pressure to increase. So I mean, like any of us, the more angry we are, the more our blood sugar levels will rise. And so this is very important to those with diabetes as well. So just trying to learn how to manage those emotions, you know, making sure we're seeing, you know, health educators or having supportive friends to help calm us down, because it could be a frustrating journey. So, I mean, with being unable to manage those emotions or maybe anger, this will most likely cause some more diabetic issues as well. So it's almost like a toxic cycle, but thankfully there's a lot of people out there and resources that help support us along the way. All right. So my next question kind of has to do with the last slide. So what control do we have over diabetes? Like we just talked about, our emotions, even though it's definitely a learned trait, having to control our emotions, we never stop learning how to do that. Learning to be maybe more calm and collective, or just kind of have to take things with a grain of salt, can definitely help us to manage how we feel on the inside, as well as how our blood sugars may look. And also our outlook on diabetes. A lot of people hear diabetes and they just they already have like this negative connotations, like this is gonna be terrible, I can't eat like this and this. But really, diabetes can help teach us a lot. I mean, we can learn and grow from the diagnosis, learning about how foods can affect us, how it affects our bodies biologically and the science of food, and just helps us to be more intuitive with how we feel and what kind of food we put in our body, and more aware versus fueling our food with maybe not as nutrients dense foods, and just like taking better care of ourselves. That helps us to take a moment and realize, hey, I'm very important. I have to take care of what I put in my body and take care of myself so that I can have the best feel. So that's definitely a good positive outlook of diabetes. It helps you to be more self-aware and aware of the nutrition in the food we're eating as well. So that's definitely like a good positive way to look at that. All right, so some fun myths around diabetes, and we talked about this a little bit earlier before we started. So common myths is like maybe you got a diagnosis and in your head you're like, oh, I got diabetes because I did something bad. And those bad things that people may associate that with is that you ate too much sugar, or that all fruit is bad, or oh, I have diabetes, I can't have potatoes or peas or bread again, which is not true. Or that you can't have any processed sugars either. So these are all myths, which isn't true. And we'll learn later that with balance, you can definitely enjoy these foods. And that diabetes, you know, it can come in all many forms, and anybody, you know, depending on how their health is or their history, anyone can get it. So it's not like you did anything bad intentionally to get this diagnosis. All right, so I have a little bit of a discussion, but like I said, if you guys are just kind of want to listen, you guys don't have to jump in, but if you do, that would be great. So what do you feel is the hardest part of your diagnosis, or maybe a loved one's diagnosis, to manage diabetes, and what lifestyle changes are most difficult to incorporate into your life? So you guys could chime in, or if you guys want to type something in the chat box, Trisha will be more than happy to share that as well.
So my diet, that was one. Eating different than those around you.
Yes, so definitely. Sorry, were you going to say something more?
I'm just reading the chat. So those are two definitely big ones.
Yeah. So like we talked about diet, it's kind of just unlearning and relearning how you eat, and just being more aware of like how certain foods affect your body. That can be frustrating, especially, and I feel like being older, or like,
I don't know.
you know, being a kid versus an adult, having to relearn those things.
They're a whole bunch. I want to see what it is.
I'm sorry, I think someone wanted to say something.
Yeah, sorry, what were you saying? If you want, you could go ahead and say it, or you could just type it in too.
I think also like more time management, because you know, if you're like at work on your lunch break, like you have to meal prep more. You know, you can't just like go out and grab like a sub, or I don't know, or something. You know, like it's, you have to like really think about what you're gonna eat, and you have to have time to like actually like meal prep or cook, or
Yeah, no, I
just
definitely,
be more organized.
yeah. That's actually a really good valid point. You do have to be more organized and have a lot of that accountability. I know working in a clinical setting, when it comes to those patients on diabetes, we have like a 4-hour rule between each meal. So we're able to help them out there, but once they're released from the hospital on their own, they're gonna have to remember to take that into account, you know, when they're at home, making sure they're not spiking their blood sugar. So that is a big change, and a big commitment is timeliness and just being more prepared than others that may not have that diagnosis. That's some good input. So I know
Another comment was preparing food for my mom after her diagnosis and knowing if I'm doing things correctly for her health.
Right. Well, first off, that's amazing that your mom has you to be supportive. And I mean, the fact you're helping her make her food, that definitely makes the journey a little more easier. And I could understand that, especially if it is a new diagnosis. You're thinking, am I doing this right? Is this going to help her? Is this going to hurt her? But I mean, the fact that you're there to support her, and we'll definitely talk more about that too, and later in the series about foods and how to prep that. But I think that's just amazing that you're willing to help and be there for her at that journey. And I know someone said eating different foods than those around you. That's also very hard, depending on the environment you live in, how they eat, and kind of being the outcast. I don't want to say it like that. That's how you feel. Like, you're like, oh, they're eating all these foods, but I can't eat as much, or I can't eat the exact portions because I have to make sure I keep my blood sugar levels stable. So that's also a good point as well. All right. Are there any more, Trisha, before I move on? Or anyone else want to say anything?
That was it from the chat.
Okay. Awesome. Well, I'm so thankful you guys were open about that. I know it's kind of a vulnerable question, but I really think it does help to open up a discussion and know that it is totally okay to have these type of emotions. I feel that sometimes medical providers just kind of give you the diagnosis and they just want you to take it with a grain of salt, but it's not that easy. So learning how to cope with those emotions and acknowledge that for what they are, and then move on, I feel like it's definitely a healthier way to go about this diagnosis. You know, just kind of going with the flow, kind of like my personality, and acknowledging those emotions, and then learning how to better yourself and your health. So we're going to jump into that. Okay, so we're going to keep it simple. So what is diabetes? So the textbook definition, but it's also a simple one, is diabetes is defined as the body's ability to make or properly use insulin as affected. So what's insulin? So insulin is a hormone that is made by the pancreas, and it helps your cells store and use energy from food. So if you have diabetes, glucose collects in the blood, but doesn't get transported into the cells. So your body's not getting the energy that it needs. We're going to hop on to the next one. So we have types of diabetes. There are 3 types. So we have type 1. And so pretty much the pancreas either makes no or too little insulin. Type 1 is an autoimmune disease that often begins in childhood, and the onset is sudden. Long ago, it's believed that, you only got it when you're a kid, and that's not the fact anymore. People could be diagnosed with type 1 diabetes well until adulthood as well. And then type 2 diabetes, which is growing more commonly here in the US. So the pancreas does not make enough insulin, or the body doesn't use the insulin it makes. So type 2 usually develops slowly over time, depending on diet pattern and history. So nearly 89% of individuals with type 2 have a body mass index that is considered to be overweight or obese. So if you have a BMI about that, overweight or more so obese, then you have a higher chance of getting type 2 diabetes. So other risk factors, of course, include a family history if they have diabetes, a history of gestational diabetes, which we're going to talk about, even certain ethnicities, impaired glucose metabolism, older age, activity level. I know for me, I'm Pacific Islander, and they're very susceptible to type 2 diabetes, especially those who are more Americanized, African Americans, Asians. So we're more at a greater risk of type 2 diabetes. All right. So, and then the third one's gestational diabetes. So with pregnant women, so the body doesn't make enough insulin during pregnancy. It is thought that other hormones may block the action of insulin. So gestational diabetes often goes away after the baby's born. However, women who develop this type of diabetes are at greater risk of type 2 diabetes and later in life, which is true. So for those of you who had kiddos or maybe supported a loved one who is pregnant, so often when you're pregnant, they'll try to check you for gestational diabetes and make you take a glucose test. You have to drink this drink, and they try to monitor that. And the latter part of this statement about those who have gestational diabetes are more likely to get type 2, that did happen to my mom. She had gestational diabetes with me, and then later on, she did develop type 2 diabetes as well. So that definitely can happen, but we're going to learn how to kind of monitor that and try to prohibit that later on. All right, so we're going to kind of talk about, the basic science behind glucose and insulin and how it works and what the heck those exactly mean and why they're so important when it comes to diabetes. So the body uses energy in different forms to keep the organs functioning, but the brain and red blood cells solely use glucose as a form of energy. So glucose is stored in the body as glycogen, and then the liver is important. It's an important storage site for that glycogen. So glycogen is moved and converted to glucose, and then when the blood glucose concentration is low. And then there's more science. So like we talked about insulin, so an elevated blood glucose concentration results in insulin secreting. And then because of that, glucose is transported into the body cells, and then insulin secretion is increased by elevated blood glucose. So far, just kind of breaking it down, it's almost like this toxic cycle that's going on between, elevated blood glucose and insulin, and having all that glucose to give you energy. Because if it's not working, then we're not going to have energy to bring up to those important organs and blood cells. So insulin resistance, which is very important, it's a resistance to the hormone insulin, resulting in an increase in blood sugar. So pretty much like what it says, if your body's resisting insulin, then your blood sugar is just going to keep increasing as well. So because some people don't produce enough insulin and other people can't use what is produced, different people take different types of medication to manage diabetes, which will also be talked about later. So whether that's diabetes medication, or they're taking insulin as well to help provide for that, for the lack thereof that their body's producing. Okay, so, and a common question that I kind of came across and I want to cover, so those who have diabetes, typically, or sometimes in the morning, they'll wake up, you know, they haven't eaten in a while, so they're wondering why the heck is their blood glucose so high if I haven't eaten in like 8-9 hours, however long it's been since you're last eaten and fell asleep. So there's two basic reasons. So one of them is called the dawn phenomenon. So pretty much an abnormal early morning increase in blood sugar caused by the natural release of regulatory hormones, which causes blood sugar to rise. So I don't know if you guys can read it. So in the picture here, it's the cortisol growth hormone, and then as you're sleeping, it'll spike up, and then you wake up with a little surprise. So that's why that can happen. And then the second one, I can never pronounce it correctly. So this one is when the insulin is taken before rest and it lowers the blood sugar too much, and it can trigger hormones to rebound blood sugar levels. So this one, taking insulin, and then your blood sugar drops super low, and then it kind of just skyrockets while you fall asleep. So for those who have diabetes, if you ever wake up and you're like, what just happened? Why is my blood sugar like that? These are definitely common things that could be the reason as to why that happened. All right. So I kind of moved along that a little quickly, but do you guys have any questions, any discussions, or even questions personally for me? I'd be more than happy to answer. I know we kind of like breezed through it, so just like let me know any thoughts or anything that comes to mind.
I just wanted to comment that last one you talked about, the Samoji effect.
Yes, that's
so yeah, that's your liver helping out with that too. So your liver, when your body's sensing that, you talked about storing glycogen in your liver, which releases back into the blood as glucose or sugar. That's your liver sensing that low sugar, saying, uh-oh, I better get some sugar back out there in the blood. And so the liver is always the one that's releasing that sugar back into the blood, whether it's the dawn phenomenon or the Samoji. So blame it on the liver.
I know.
It's not what you ate, like you said, 10 hours ago or however long it's been. It's the liver just doing its job, basically.
Right. And thank you for better explaining that too. Trish is like the queen when it comes to diabetes education. So yeah, dang liver. No, but thank you for that elaboration. And yeah, if you guys have any questions, just chime in verbally, or Trisha will read it from the chat.
You got a comment? I think you did a great job.
Aw, thank you, whoever said that.
From Kevin.
I appreciate the support a lot. Thank you. And I don't know, while we're waiting for any comments, I know I talk about my experience like clinically, but working at a hospital really does open your eyes, especially with these diabetic patients. A lot of them are elderly and they're just now being diagnosed. So them having to come to this realization, like, I've been eating or doing things this way for so long, and I'm gonna have to relearn and unlearn it. Like, they become very frustrated, especially when ordering food on the phone or having to look at a menu with, certain portion sizes or foods they don't agree with. So if you're like me and you don't have diabetes, thank God, but you have someone in your life that may have that, just being that support system and just having that understanding of what's going on, biologically, or why they may feel this way, or maybe they're frustrated because of everything going on. And also having a low blood sugar, you're more likely to become frustrated as well. So just having that understanding and open heart and just holding their hand along the way. I mean, a big support system goes a long way. I feel like just having someone behind your back and just being there for you along the journey means a lot and can really help to increase like a successful management rate.
So there was a question, and let me know if you want me to help answer it as well. Should we be concerned that we have a few days in a row with a number that is high in the morning, or is it the dawn effect?
That isn't the dawn effect, is not?
Or is it the dawn effect?
I mean, you could jump in, Trisha, too, if you would like, but I would feel like if it's like a reoccurring thing, that's definitely something I would try to talk to your doctor and mention. It's definitely worth mentioning. Better being safe than sorry. And I'm sure you definitely have some good input on that as well.
That's exactly what I was going to say. But yeah, sometimes and everyone, like she mentioned, takes different types of medication. So sometimes it might need to be a simple adjustment too in a medication, and because some of them work differently. So I would definitely, like you said, keep notes of all those sugars and bring those to your doctor and get advice from them what you should do if it's medication related, or if there's some other reasoning too, they can help identify that.
Exactly. I guess I'm the type, like Trisha said, especially when it comes to our biological body and like blood glucose levels, definitely bring everything up with your doctor, because we do not want anything to happen and just want to keep you healthy and stabilized. All right. Any last questions before I move on? All right. Well, I appreciate you guys listening to my portion of this presentation, and then I'm gonna stop sharing my screen so that I can allow Teresa to kind of get more depth with this and more science and health part, and I'm excited to hear what she has to say. So let's see. Am I stopped sharing on here?
Yep, I think you're good.
Okay.
All right,
Take it
thank
away.
Bella. Yeah, so take just a minute to get my screen up. You did amazing, Bella. I am definitely the less bubblier of, of our little group here, but I will do my best to get through this. Let me bring this up. All right. Does that look okay? Brought the screen up. Okay.
Yes, I see it good.
All right. This part is that I get to see, oh, hold on. I'm not on the right page. The best part is I get to see Bella's face still. Is still here. Okay. All right, so Bella talked mainly about kind of the intro to diabetes, what it is, you know, kind of getting that first diagnosis. Now we're moving on to like, okay, I have diabetes, what am I doing next, right? So a big part of having diabetes is monitoring your blood glucose levels. And like Bella talked about, those are very important when it comes to diabetes, because we need to make sure that we keep it in check so that insulin levels aren't, you know, going haywire. So let me do a little introduction. My name is Teresa Mazza. I am originally from Boston. I don't have a crazy accent, but I moved here about almost 11 years ago now. We lived in Florida for a little bit of time, but spent most of my time here. I started out as a chef. I worked at the Boston Garden. I was a chef there where the Celtics and Bruins play. Job ever, but that's kind of where I started my love of nutrition. We saw a lot of very unhealthy people eating a lot of very unhealthy things. And, you know, I kind of thought like, hey, I need to be on the other side of this. In 2015, I graduated with a Bachelor's of Science in Health Promotion, which qualified me to sit for the Certified Health Education exam. So I am a certified education specialist. In 2018, I got a Master's of Science in Public Health. So this practicum has been amazing so far. We are in our community practicum. Like Bella said, this is our last one. And I love the public health aspect of it. And I enjoy, you know, doing things like this, like teaching, all of that. Again, I'm currently in my last practicum to get an Applied Associates of Science in Dietetic Technology. And my future plans are actually, I may have not have told you this yet, Trisha, because you had mentioned going for a bachelor's, but I actually would love to be able to go to to get a second master's degree with their future education model to become an RDN. Okay, move my little screen over. Okay, so what is glucose and how is it measured? So glucose is the body's main form of energy. You pretty much are going to get glucose anytime you eat any sort of carbohydrate. So if you're eating fruit, if you're eating lettuce, if you're eating bread, you're going to get glucose from it. Blood glucose can be measured either at home or through laboratory testing at your doctor's office. So we'll get a little more into it, but for now, A1C testing is what you would get done at the doctor's office. And then at home, you can either use a home glucose monitor or a continuous glucose monitor. And we'll get a little more into them as we go along. Home monitoring is very important. So, you know, kind of just going by, I can kind of say from experience, my grandfather did this for a while. He was kind of just going by how he felt. He'd be, you know, he was like, well, I'm feeling, you know, a little dizzy. I'm not feeling that great. I'm going to have some, you know, like an orange juice or something to hike up my blood sugars. Or if he started feeling like nauseous or, you know, started feeling a little jittery, he would be like, okay, I have to back off. I need to, you know, do something to lower my blood sugar. He has a continuous glucose monitor and he's realizing how very off he was with just monitoring symptoms. Unfortunately, that is when we start seeing, if you're, you know, doing things like that and not monitoring your blood glucose, that's when you start seeing more overall long-term health complications, things like vision problems. You know, you hear about people, you know, losing toes and things like that. That's from very long, you know, that stuff sounds scary. Really, if we can manage our diabetes throughout and, you know, make sure that we're constantly checking, these things are much less likely to happen. So hemoglobin A1c. So this is the test that is done at a lab or at a doctor's office. It's typically done every 3 months. It shows, it's almost like a report card. It's showing the average of a 3-month period of your glucose. This is said to be the most accurate way of knowing of how well controlled your diabetes is. So when you do get this test done at the doctor's, your goal is to have it at a 7.0 or lower. That's, you know, it's kind of like the golden point. If you do have an elevated A1C, and especially if it's 8.0 or higher, that's when we start seeing some of those complications that I was just talking about. So people with an A1C of 7 or less, they typically have less risk for heart disease, stroke, kidney disease, eye problem, foot problems, and nerve damage. So keeping that number in check and really making sure that you're going every 3 months to stay, you know, monitored, definitely kind of like the best thing you can do for your preventative health. You know, you don't want things to get worse. You'd rather think, you know when things are getting bad. Okay, and then a home glucose monitor. This is probably like the thing you think about when you think about diabetes, right? Is the little prick that you have to stick in your finger. These will reflect the amount of blood glucose in your blood at the very moment that you're taking it. So it's not like an average of, you know, the last week or whatever. It's your blood sugar right then and there. Because most foods contain glucose, or they have sugar, right? Because glucose is a sugar. Blood glucose levels will increase after you eat. Just, you know, that's the way it is. Your target blood sugar levels are between 80 and 120. So, you know, just don't, you're, you know, right before you eat, you're, you know, ready to go. You should be about 180 to 120. 2 hours after eating, your blood sugar levels can be at 180 or less. This is when you want to check this about 2 hours later, but this is 2 hours after you start eating. So not like you eat a whole meal, you've been sitting there for half an hour, and then you check it 2 hours after that. You know, right now it's like 1:30. If I was to eat right now, I would check it at 3:30. And then checking throughout the day, again, is crucial for proper management. So just like I was talking about with my grandfather, being able to check throughout the day, or what Bella was talking about with the morning, with the dawn effect, knowing when your blood sugar levels are high or low will definitely help you better manage. So maybe you are waking up, finding that you're waking up every day with a higher blood glucose level. Maybe you have to kind of take an effect what you're doing. Are you eating a pint, you know, a couple scoops of ice cream before bed? Or are you eating, you know, a really healthy, balanced meal before bed and it's still, you know, spiking? That's something that you want to speak to your doctor about. So being able to check your blood glucose throughout the day is going to help you better manage and help you make better, more informed decisions about what you're eating and what you're doing. Same thing could go for like a workout. Say you're finding that after a workout, you're not feeling that great, or you're feeling, you know, dizzy or lethargic. that could be your blood sugars dropping quickly, and you might find that you need to have a snack midway through working out. That's where the home glucose monitor comes in. They come in a ton of different options now. You can get like pink ones, you can get decorated ones, you can get just plain black ones. They come in all different sizes. Some are portable, some are, very technologically advanced. They hook up to your phone. Some are very expensive. Really whatever works for you. Definitely talk to your doctor about that as well to make, see what's available through your insurance or what's available to you. A continuous glucose monitor. So this is what my grandfather ended up getting, and it's been amazing. It is a little device, and I don't know why my picture didn't switch out on my slide, but it's a little device that you can put a lot of people put it up on their arm, or you can put it, people put it on their abdomen, they put it on their backs, they put it on their legs. It's a little like pin that sticks into your arm, and those stay there for 2 weeks, and it's usually hooked up to a monitor. Sometimes they're hooked up to your phone. They will track your blood glucose level 24 hours a day. And this is usually at a predetermined interval, so between like 3 and 5 minutes. But these little sensors are great because you can see right at you eat something, you can see how much longer after, if you're having spikes or if you're having quick lows. It's really great information to have all day long. Or if you're having trouble in the middle of the night, if your blood glucose starts dropping or gets really high in the middle of the night, there's actually these machines, these monitors have alerts on them. So if your blood glucose really dips or really goes high, it will alert you and wake you up so that you can then either go take some medication that you have from your doctor, or go get a glass of orange juice, or whatever you need to do to bring your blood sugar back up. The sensor will also send information to the device so that information is stored, so that's something later on you can go and talk to your doctor about. So that information is just all ready to go. You can say, hey, I've been dipping in the middle of the night, or after I work out, this is happening. So it's a really great tool. The only thing about them is that they can be expensive, and they're not quite as accurate as the finger pricks, but great to use in conjunction. And then also it means finger pricking. And I know that that's kind of a big thing, with diabetes. You always hear about raw fingertips and having to prick your fingers multiple times. This is one prick for 2 weeks, and then you can move it around your body. Okay, are there any questions about glucose monitors?
I feel that you did a good job at presenting the topic, because it can be complicated, the glucose monitors, but then diving into the detail. And I feel like the example you shared with your grandpa kind of just helped make it more, I guess, visually realistic for us, and kind of see how he dealt with that, and how you can't necessarily just guess what your blood sugar is like you need that science and help.
Sure, yeah. He was definitely just guessing all the time. And this was a big eye opener for him. I think he thought hey, I have blood sugar, I'm gonna go eat a couple scoops of ice cream, and then now he's realizing, hey, I'm having way too much ice cream to bring my blood glucose up. It's actually going up too high. So it's definitely a great way to kind of just monitor things are going throughout the day.
Yeah, definitely.
And I did want to comment. So my friend, she has type 1 diabetes. She's my friend that she was diagnosed at 21 years old in college. Like you mentioned, some people get diagnosed not as a child, but later in their life. She just informed me they just came out with a new continuous glucose monitor that is so accurate now that it was replacing finger sticks.
Oh, that's wonderful.
Yeah. It talks to her insulin pump.
That's amazing. I forgot to mention as well that, thank you for bringing that up. I forgot to mention that they can also connect to insulin pumps. So if you are someone who experiences type 1 diabetes, they will talk to your insulin pump and say, hey, we need a little more insulin, or, we need to back off. It's really, they're amazing tools. Were there any other questions, Trisha?
Nothing on the chat at the moment.
Okay, I will move along then. If anybody has any other questions on it, we'll definitely take questions at the end as well.
I have a question.
Oh yeah, go ahead.
I checked my mother's, I think, with her prick, and she had been on metformin, but the past 5 years, we got to took her off, and she's just doing diet control. But sometimes in the morning, she will have like 180, and then I'll take it again immediately, and it will go back to 120 or the normal range. Why does that fluctuate? Is it
So she takes, I'm sorry, I just want to make sure I could hear you. It's a little muffled. So was it, she takes it in the morning and it's 180, and then how long after are you taking it?
I would do it immediately, because I'm like, oh my goodness, it's high. Why is it high? And I'll do it again, and it'll be like 110 even. And so what is it? Is it not reading accurately? Is there something wrong with the machine, or why does that happen sometimes?
I would assume that there could be something wrong with the machine, or it's not being taken properly. Because if for it to, your blood sugar wouldn't change that quickly, especially if it's immediately after. Trisha, do you want to chime in on that?
I do know sometimes, when you wipe your finger with an alcohol prep pad, you want to make sure that that alcohol is completely dry, or even like wipe it off, with like a tissue or something, because sometimes the alcohol is still wet. It can give a different reading on the machine too.
Oh, great point.
So would I, since it goes down to a good number, then I just assume that nothing is wrong. And so is that a correct, if it changes, goes high and then low, if it does that, is the lower number the more accurate number?
Well, from the way it's sounding, if it's something kind of like what Trisha is saying, it sounds like the higher number would be the more accurate number. Maybe try doing it on the complete other hand for the second try. Also, I just had, and I drew complete blank, but I feel like if it was something like what Trisha's saying, maybe try it on a different finger or on a completely different hand. Or maybe it might even be time for a new machine. Or maybe next time you are at the doctor's, having them kind of give another little tutorial on how to use it, just to make sure you guys are using it correctly.
Thank you.
No problem. Thank you, Roxanne.
Yeah, and another thing, it could be medication related. The medication could be kicking in too. So so it could be a lot of things. So it'd be want to look at every little piece in the doctor's office.
Okay, so Bella started touching on this about, kind of like the emotions and all that, and now we got our diagnosis. Now we have to know like how we're going to live with this, right? Obviously this is going to be an ongoing emotional roller coaster. It's not going to be one day it's 100% easy and that's fine. It's going to be like that forever. And that's okay. It's okay to have, rough days. But we're going to talk a little bit about self-management of diabetes. So no matter what type of diabetes you have, it can be managed with diet, exercise, glucose monitoring, like we just talked about, stress reduction, and sometimes, if needed, medication. Obviously, type 1, your pancreas just does not make insulin. So you're gonna need insulin. So that's like a medication that you're going to need to be on. But a lot of times, if you have prediabetes or type 2 diabetes, you might be able to get away with, depending on what your doctor is saying, monitoring it through self-management. So I have some tips here for living with diabetes. First is your doctor's appointments. So you want to make sure that you're going to all of your routine doctor's appointments. This is just crucial for proper management. Like we talked about with the A1c, going every 3 months to make sure you're getting that checked out, making sure that you're, that it's level, that it's in the right range. If you're going once a year to the doctors to get your A1c checked, you don't know what's going on, right, within that year. You could, it could get really high at some point and you'd have no clue, and you could be living with this for a year. And that's going to start bringing about complications, right? So we want to make sure that we're going to all of our doctor's appointments, and that we're getting all of the labs done that we need to get done. I know that's very easier said than done. Sometimes there are barriers to getting to doctor's appointments. And if that's the case, definitely reach out to your doctor. A lot of doctor's offices will, especially nowadays, they'll do appointments virtually. They'll work with you on what labs you need to go to, things like that, or even costs, stuff like that, getting supplies, blood glucose monitors. Just ask. There are resources out there. And again, on the asking front, is ask for help. Don't feel bad to ask for help. If you get this diagnosis, you feel very alone. Like, what am I going to do? I saw someone in the chat say, what am I going to do now? Never feel bad to ask for help. Let your close friends and family know, what to do if you are experiencing like a high or a low. Hey, I have this I have some juice, or I have some candy in my purse. If I'm not feeling well, can you give that to me? Little things like that, just so you feel more comfortable being out, or, being with your friends. And even some stresses, if you're just feeling like, hey, today has been a rough day. Like, I've had a hard time with my blood sugars, or I feel like I can't do this, or I can't do that. Reach out to the people that you love and ask for accountability. If that means, hey, like, I really want to, lose some weight to help manage my diabetes, ask for some accountability. See if they will go for walks with you, or, maybe even going to, like, Bella works at a meal prep service, something like getting some meal prep done. Anything that you need, ask for help. Don't feel like you have to do it all yourself. And then Trisha, my very favorite tip, is to eat more plants. When you eat plants, you eat fiber. Fiber is the most, I feel like, underappreciated nutrient out there. And here's why. So fiber helps to slow the absorption of glucose in the body. So it helps you to actually improve levels. That's why when Bella was talking about how fruit isn't bad, reason is that fruit, while yes, it is high in glucose, it's high in sugars, it's packaged in a pretty little package with fiber and all kinds of other nutrients, vitamins, antioxidants, minerals. Fruit is an amazing little thing, and fiber is reason for that. A plant-based diet is also, so when I say plant-based, I guess nobody's telling you that you need to give up meat. Nobody's telling you need to give up everything that you want to eat or love, but it does mean to try to make most of your meal plants. So plants are a broad thing. It isn't just fruits and vegetables. That also includes beans and rice and whole grains, things like that. So that type of diet is going to provide more nutrients. It's going to have less processed foods than the standard American diet, and has also been shown to help with weight loss. So you're going to have less sugar spikes because you're not eating foods that are just high in processed carbs or high in processed sugars. And a plant-based diet is going to fill you up more because it's filled with fiber. So that is definitely going to help with weight loss and help with how you're feeling, really. Bella, did you have something you wanted to add?
Yes. Oh, yeah. So, and I could have mentioned it earlier as well, but for on number 2, when you talked about just like accountability and just having like the good support system. I mean, we talk about like having people, but I know like I don't have family out here, so sometimes it's hard to find like people close. So there are like legitimate resources, like say you are a woman and maybe you have like a young kiddo, even though WIC, after you have a kid, it's more catered for that child. They still have like resources for diabetes. So if you need help there, they can definitely help you with the education aspect. And WIC is also a free resource as well. I mean, there's even like Facebook groups so that maybe if you're having like a rough day, you can vent to or ask for tips as well, from like a friend perspective. So, I mean, aside from having loved ones, there's like professionals, I mean, like registered dietitian, diet technician, and then at PV sometimes, and we might start them up again, we do like little consults with the more experienced diet technology students, so you could always ask questions there as well. So There are
Yep.
legit resources out there too.
Yeah, that's a great point. Is that, yeah, I guess, I mean, we don't always all have friends and family we can turn to. And if that's the case, definitely reach out to, you know, your local college, their fitness center, you know, or your doctor, or ask for, yeah, Facebook groups, everything, right? It's so much easier to connect with people nowadays. Okay, so tip number 4 is to move your body. Physical activity can help to decrease blood sugar levels and other aspects of health. So when I say move your body, I'm not saying that you need to go to the gym like 6 days a week and, you know, do like a 4-hour workout. Something as simple as a 20-minute walk is going to be is amazing. It's perfect. It's just you just want to get your body moving each day, get your heart pumping. This is going to help decrease blood glucose levels, and it's also going to help with heart health and all of that amazing stuff. Just again, be careful, like we were talking about earlier. If you are like, you know, someone who really does some more intense working out, just make sure you're tracking your blood glucose, because it can drop significantly if you're not careful. So sometimes you might say, hey, if I'm doing this type of workout, I need to have a snack in the middle, or, you know, maybe I need to eat a little more of a carb heavy meal before I start working out. Managing stress. I know Bella touched on this earlier. Figuring out a way to manage your stress. So whatever that is for you, if that's going for a walk, maybe it's doing yoga, maybe it's journaling or talking to a friend. For me, it's like going to sit. This has been awful this year. It's been going, you know, it's going to sit at a coffee shop and having a cup of tea, something like that. Anything to help you with relieving stress, because increased stress does increase blood glucose levels, and it also can lead to other poor lifestyle choices. I mean, think about it. When we're stressed out, what do we reach for? The ice cream and the cookies. And while that's fine in moderation, if we're doing that all the time, we're gonna stress out our body as well. And then my last tip is to manage alcohol. So talk to your doctor about what would be an acceptable amount of alcohol for you, and then choose wisely when you do, and always consume it with food. So obviously, you know, drinking some of these really fruity, sugary drinks might not be the smartest thing to do when it comes to drinking and diabetes. But always make sure you're eating it with food so that your blood sugar doesn't just, you know, go crazy. Okay, so I just wanted to almost end by telling you to join us next week. We're going to be here next week. It'll actually be Trisha and I. We're doing another webinar on the 18th at 1 o'clock. Trisha will be talking about hyper and hypoglycemia and managing blood glucose levels, and I will be talking about an introduction to nutrition, just to kind of get us thinking about what could we be eating to help us better manage our diabetes. And then the week after that, Bella will be back. So make sure you're tuning in each week. And then questions. Do we have any more questions? And Bella, feel free to help with questions as well if you'd like.
All right, I'll unmute myself then.
It can be about anything in the whole presentation, even Bella's, because Bella can help out with answering questions.
I have a question. I was diagnosed as pre-diabetic. Would that 3-month test be appropriate to see if I'm staying pre or moving further into?
Yes. I would definitely say to continue getting that done. And the thing with pre-diabetes is that you can turn that around, right? So I would, or again, like you said, it could progress, right? So getting that test done every 3 months, I think, would be very important to just kind of see where you're at.
And it looks like Virginia had like almost like a very similar question to Roxanne. So like, yeah, just still monitoring that. I mean, eating as if like, I don't want to say eating as if you have diabetes, but like, you know, having like good nutritious foods, being cautious of your eating patterns, you know, if you're eating before bed to prevent that like blood sugar spike, or yeah, like the types of food you're putting in your body. So just be more cautious so that you're more likely to reverse the adverse effect of becoming legitimate diabetic. So, and then we'll definitely dive in more into that within the next couple of webinars, especially next week when Teresa talks about nutrition in regards to diabetes.
And I think week 3, we're going to really dive into more advanced like carbohydrate counting and teach a lot about portions and how carbs like turn to sugar, and like Teresa mentioned, like that importance of fiber, like choosing like even certain fruits you might respond better to than others. Like I have patients who keep notes for me all the time, and they're like, I don't know why, but for some reason, mango just makes my blood sugar shoot up. But if I eat an apple, I'm totally fine. So kind of even as an individual, everyone can be so different on how their body responds. So we'll dive into that in a lot of detail in week 3. We'll start talking about it next week, and then we'll just keep building on it so that you have all the tools, whether you have prediabetes, to help, like I said, reverse that, or if you have type 2 or type 1 to get those blood sugars down in that healthy zone, so you feel your best.
Yeah, kind of to piggyback on that, as ironic as it sounds, and I know diabetes isn't, isn't a fun diagnosis, but it like almost it makes you like be more intuitive and more aware of your body, like you mentioned, like the mango, like even little things like that, like you're more cognizant of what specific foods make you feel that way or how it affects your body. So I guess in light of the diagnosis of diabetes, it's definitely one way to view it. You're almost forced to be more intuitive with your body, which is definitely something a lot of us can struggle with until that's the only choice you have. So I feel like that's a good perspective on how to look on that type of diagnosis.
That's a great point.
Yeah.
Any other questions?
Well, you did a good job, Teresa.
Thank you, Bella.
Yeah.
I'll just wait another minute in case anyone's typing, if they have any more questions for the chat. Or feel free to turn your microphone on as well. We got a thanks.
Thank you. I will stop sharing as well so that I can see everybody.
So yeah, please join us every Thursday at 1 for the next few weeks, and hopefully we can keep diving in more. You'll probably have more and more questions as we move forward, and if you can't make it, like Tatum said, she's recording them, so you can view it at a later date. And I did want to mention, just in case people don't know, because it's not communicated very well, of some of your preventative benefits of your health insurance. Health insurance does cover diabetes consults, whether you're pre-diabetes, type 1 or type 2 or gestational, for you to see a registered dietitian for free. Like, so you just have to basically make an appointment, and the dietitian that's contracted with your insurance just bills your insurance. So you can always check with your insurance company about your benefits and see which dietitian is contracted with your health insurance. Depending on the health insurance, you may or may not need a referral from your doctor. I know Medicare does. Most commercial plans do not. But just know that that's available if you need that individual one-on-one help. It is covered by insurance. So you can always call your carrier and check into that too.
Thank you for the love in the chat box. We appreciate it.
No, makes us feel good. Yay. And yeah, you guys could also share the links, right? They could share the WebEx links to the future presentations. So if you have like a loved one that you may think they might be interested, they could tune in. We're inclusive, so everyone's welcome. Safe space. Everyone can come join us. So yeah, we appreciate your guys' time today.
Yes, Anna, this will be available at a later time. Tatum, do you want to let everybody know where it will be?
Yeah, so we will have these links posted for the videos, and they'll be in 2 different places. On the Paradise Valley Community College homepage, if you type in the search bar Fitness Center, these videos will be available on the Fitness Center along with the Integrated Health Science Center webpage. But initially, your easiest link will be going just directly to the Fitness Center webpage, which will, again, have the link for these videos. It usually takes at least 24 hours for me to have access to videos to upload them on the website, but we will have them at a later date. So again, if you know of anyone who couldn't make it today, please let them know. You can refer them to that video link, and hopefully they can make it, on a future Thursday. So today was more of the introduction into the topic of diabetes, but the next 4 weeks definitely start diving a little bit deeper, as Trisha indicated. So we thank you very, very much for attending, and definitely we appreciate the presenters today. You guys did wonderful, and we hope to see you all back next week. Thank you.
Thank you, everybody.
everybody.
Appreciate it.
Thank you.
Thank you.
Thank you, Valentina.